Is it fair to say that you spent your entire career preparing for a moment like this?
That's pretty precise.
But did you ever expect something like this pandemic?
Absolutely. We exercise for these types of pandemics. We anticipated that we would have another pandemic.
You had practiced this.
We drilled. We'd practiced. We'd been through Ebola. We'd been through Zika. We'd been through H1N1. This was not a new thing for us. We knew exactly what to do.
What is BARDA's mission, and how does it fit in the response to a coronavirus like this?
BARDA was created to be able to respond to a coronavirus pandemic like this. We focus on chemical threats, biological threats such as anthrax, nuclear threats, radiological threats, pandemic influenza, and emerging infectious diseases. And we have a unique role at BARDA is that we bridge government and private industry. So BARDA would be responsible for working with industry to make the vaccine and ensuring that we have the raw supply chain for the vials and ingredients that go into the vaccine. In parallel, the Strategic National Stockpile would take the responsibility for buying the needles and syringes to making sure they were available when we had the vaccine ready. It's a collaboration.
I mean, it sounds like BARDA was created to deal exactly with a moment like what we're in.
That's accurate. BARDA was created for this moment.
Part of what your story does is help us understand what's happening in private, behind the scenes, whereas most of us can only see what's happening in public and what we're reporting on. The president was in Davos on January 22nd, and he said, "We do have a plan, and we think it's going to be handled very well." Was there a plan?
We had several plans. We had exercise, we had pandemic response plans, we had national response plans, we had departmental response plans, we had office response plans. We had many plans, Nora. However, most of those plans are still on the shelf.